And so I am so proud to have him here with us again, 2 years in a row, Dr. Skip Lenz.
My professional career has been spotted in that I actually worked for, my friend Larry Frieders calls it the evil empire. I spent a lot of time doing research and development in the evil empire. Okay. Side effects, that's the other thing that we talk about or the telephone calls that I get are side effects. Again, this is an anecdotal study. You're gonna see the questions that we asked. Okay, the questions were quite similar to the efficacy study that we did last year. We didn't talk to doctors, we talked to people. We talked to the people who were taking the drug. And having been part of clinical studies, I know it's not double-blinded and it's not scientifically rigorous and everything else, okay? I'm a duck guy. If it looks like a duck and it walks like a duck and it quacks like a duck and it lives with ducks and it has eggs, it's probably a duck. Now, I could be wrong. It could be a platypus. I doubt it, okay? Why are people de-seeing? Why are people coming off of these drugs? Are they coming off of these drugs because of side effects or for some other reason? And what we did is we designed the study, and again, my students designed the study. I asked the questions, the students designed the study. Why? Why did you come off? Why did you stop taking it? Okay, we generated a list from 6105 to 123105. Okay, of all of our new patients. It was randomized, and I don't have a clue how they did it. They put it on a program, and they pressed a button, and they got randomized. We asked a list of questions, which we're going to go through. The list, the students actually asked the questions and listened to the answers. And then I and one of our other pharmacists sat down and looked at the answers and put them in an order that we think is appropriate. Here are the questions. 1, are you still taking naltrexone? If yes, are you experiencing any side effects? If yes, what are they? If no, what reasons did you stop taking the drug? And did you have any side effects? The interesting thing is that there were some people that had no side effects and said, well, what should I be expecting? So we had a total of 545 patients on the list. 177 of them did not respond. We called 545 patients. 177 of them didn't respond to the message. We either, they weren't interested, they didn't want to talk to us. Which is really interesting because the last survey we did, we had about a 90% response to it. 113 we were unable to contact. Either their telephone numbers had changed, they didn't answer their phone. So we contacted 255 patients successfully. 80 patients discontinued the use of naltrexone, and 175 patients still used naltrexone. Patients not contacted. Now, what we did was we took that 545 number or 555 number and we backed up into our computer base and to see if they were still taking naltrexone, and we just didn't hear from them for one reason or another. 273 of those were current with their prescriptions. So if they got a 30-day supply, if they had that prescription refilled within a couple days of the 30 days, then we knew they were current. Okay, so 273 of them were current, 17 of them were not current. Side effects. Number one on the hit parade, sleep disturbances. 51% of the patients had sleep disturbances. That's why we use this as a marker, okay? If more than half of the people are having sleep disturbances, then we know that they're getting the drug. Stiffness. Now, our population is basically made up of MS patients to a great extent. 25% of them had stiffness. 6% had headaches. 6% had GI disturbances. 3% had gait disturbances, and 9% had other. And these are the side effects that side effects patients that discontinued. So these were side effects that the discontinued patients had. 49% had sleep disturbances. 25% had stiffness. 13 had headaches. 13 had headaches. 13 had GI disturbances, and there was other. There was an interesting number that came up that out of the 80 patients, 24 of them actually, they had side effects, but 24 of the 80 patients actually stopped taking the drug because their doctor told them to stop taking their drug. That's it, you know. I wish we had more Irish doctors here, I guess. Okay, so how many side effects did each patient have? You know, were we just talking about one, you know, the sleep disturbance thing? 19% or 19 patients on the LDN had one side effect. 8 of the patients that discontinued had one, and 7 of the patients still on LDN had 2. You know, you scratch your head when you get these numbers. I do anyway. Okay, so this is the interesting number. There were 0.183 side effects, which is sort of a stupid number, but people in research use these numbers. 0.183 incidents per patient still using the naltrexone, but only 0.1 that have discontinued it. So people who are staying on it will experience more side effects than people who will come off of it. Again, number one on the hit parade is sleep disturbances. My gut feeling from talking to patients is that it lasts only maybe a couple of weeks at the most. I had one lady that it lasted a month. But she was feeling so good during the day that she didn't care if she was having sleep disturbances. It is significant to me that a person who is, and I'm really hard-nosed when it comes to these types of things, that this is an issue and this does happen. Okay, so be aware of that. You know, when you write the prescription or when you're talking to people, tell them, yeah, you're going to have sleep disturbances. It's going to be for a while, but you're going to feel fantastic during the day. I don't really care what the establishment says. You know, look at me. You know, that's not in my realm. But it's important that somewhere down the pike that it becomes an accepted drug, because this drug, literally in my 30-some-odd years of practicing pharmacy and doing research, is one of the, if not the most significant drug that I've ever run into. There was actually a study done in Germany a couple of years ago. Dr. Moss, I think, was it? Dr. Meir. And for some reason, they were giving it in the morning time, and he had a tremendous failure rate. So I believe that at bedtime is the best time to do it.
Where people worked at night, and Bernie made the point that he knew it was peculiar, but it doesn't matter when you're active, when you're sleeping. Please take it between 9 p.m. and 3 a.m. And the patients did continue to take it in that time span and had great success. When if you take the blocker, which LDN is, at that time, then you interfere with what is called the pre-dawn phenomenon, when most of your endorphins for the day are made.
What we really need is for some fat cat drug company to come down and say, okay, we're going to do a nice thing and actually do a clinical study. That's what we need to have done. Up until that time, you're going to have yutzes like me generating data like this. The dialogue that's going on, okay, what we're looking at is we're not looking at the same sort of dynamic and kinetic at a high dose versus the low dose. That's going to be different. That is different, because if you took 50 milligrams of this, you should be a real happy guy. Your MS symptoms should all go away. You know, life should be wonderful, but that isn't what happens. So there's a different dynamic that's going on down here at the low dose that until we can get, you know, somebody other than a guy sitting in a pharmacy doing this sort of clinical research, it ain't going to happen.